Hi, welcome to May. Today we're going to talk about strokes. Strokes are one of those things that if that happens in your office, you automatically call 911. You're not deciding if you're calling 911, and the faster that you can call, the better. So basically, someone is symptoms of strokes are paralysis on one side, right? So it's usually like there's facial droopiness, there's, like their whole body will kind of go limp on one side. It could be subtle, it could be really significant. So you want to kind of watch for that. So if someone's complaining about like all of a sudden there's visual changes or they're confused or like they start slurring, you call 911. There's an acronym FAST that basically means facial drooping arms. So you could say to someone, put up your arms. And if they put up their arms like this and one is not up, that's a sign that they're having a stroke. S is for speech. So that would be, say, you're talking to them and they just don't make sense or they're, have sort of garbled speech. That's a sign. And then T is time. So you don't have to go through all of the acronym. If you see someone with any of those symptoms, you call 911 because the faster that you can get them medical help, the better off they are, their outcome. So if you see anything that you're concerned about a stroke, I mean, obviously, if you just give someone like a lower block and like now their face is drooping a little, that's a different situation. But if it's, all encompassing, if it seems like something's going on, you just call 911 and you just call it a day. Okay, so that is our medical emergency for the month here. The other thing I really want to talk about is chemical indicators. I see a lot of people kind of doing different things with chemical indicators. So you want to make sure in your bag. So I have a bag here. So in the bag, it's hard to see, but in the bags that you have, there should be an external indicator, which is this little pink thing here, and an internal indicator, which is a little pink thing here. So if you don't have a bag that has an external and an internal indicator like that, you need a separate internal indicator inside the bag. And that is either a folded piece of autoclave tape, that's a little strip, that goes in the bag. So there's that. Then if you have a cassette, I have pictures for you about cassettes. So any cassette, you want to put an internal indicator inside the cassette and then an external indicator on the outside. And it's really important. The external indicator usually just tells you, on a wrap, it just tells you that the instrument's got hot. It doesn't tell you that all the parameters of time, temperature, and pressure actually worked. So you really want to make sure that the internal indicator goes inside and it has to touch the instruments. It can't be like just inside the package, right? The idea is that all the parameters went to the actual instruments. So feel free to reach out if you have any questions, but internal and external indicators are really important. And then obviously you're checking them, right? There's no reason to have them if you're not looking at them. So if you open a package or you look at a package and the indicator, it still looks pink like this, right? It didn't change color to a darker color. It's not clean. You're not using it. If you see the outside of a package has the indicator change and you open it up and the inside doesn't, same deal. Reprocess, right? Don't use anything that has an indicator that hasn't changed. Okay. So we're also going to have Russell's going to talk about some emergencies in the office, sort of general office emergencies. And as always, any questions, feel free to reach out. Thanks. Enjoy spring.
Hi, everyone. This is Russell from Dental Office Compliance. I want to spend a few minutes talking about office emergencies. OSHA requires your office to have what's called an emergency action plan that covers how to report emergencies, evacuation procedures, how to account for your employees and patients in the emergency, and also employee assignments. So it may be the case that you've delegated certain tasks to certain people in the office. You will find such a document in our portal. It's called the Emergency Planning and Disaster Recovery document. You can simply type that phrase into the search anything box and your EAP will come up. The office manager has responsibilities under this plan, and they include the following. We'll cover this in a little bit more detail in the next few slides. I do encourage office managers to read the EAP in the portal. Make sure you understand what it says, and more particularly what your responsibilities are in different types of emergencies. So one responsibility is to maintain notification systems. So this includes contact information for all of your employees, as well as for authorities that can help you in the emergency: police, fire, building manager, etc. With respect to the other contacts, in our key roles document in the portal, we've provided a place to keep those listed and current and make sure everybody has access to it. So if there are any changes or the information's incomplete, please go in there and make those changes. You can download the document and upload it again, or if you need to, just give us the information and we'll update it for you. The office manager should also test alarms notification systems. So this would be fire alarms, smoke detectors, and a notification system might be like a call tree where you reach out to different employees, or maybe there's responsibilities for some employees to contact others. Make sure everybody understands your protocol. The office manager should also keep the controls and equipment to prepare for an emergency. So these include exit routes, make sure they're posted in various locations. Exit signs are visible, and employees know where and how to exit, but also once they exit, where do they meet? Everybody should have a designated meeting location away from the building, and it's good to practice this once a year. I think, there is turnover in staff sometimes. Sometimes people forget, but this kind of builds the muscle memory. Should the emergency happen, you don't have to think too hard. You just know how to act. And then fire extinguishers, you want to make sure you have them. They're visible, they work, and you do inspect them from time to time. Usually there's a tag on there that tells you the next inspection date. We're happy to maintain those dates for you and give you alerts in advance so that you can make sure you hit your mark in terms of getting those inspected. Office managers want to maintain first aid kits that are complete, that have the following items, but also that are easy to find in the office and everybody knows how and where to find them. So that's something that we often look at when we do office inspections. We're going to talk about just a few emergencies that you might encounter. So fire is one of them. All of you work with a lot of chemicals and work with a lot of products, and certain of them are flammable in certain situations, and if, especially if they're combined. So if you do work with certain chemicals more often, look at the safety data sheets for such chemicals. They will tell you all the hazards and also how to handle them safely. But if there is such a fire, the office manager should alert the authorities, should coordinate the evacuation of employees and patients, should shut down any systems or equipment that could be damaged in the fire, but also could create hazards for fire department personnel going through the space. And then, if appropriate, using a fire extinguisher. Now, not everybody's used a fire extinguisher, yet we all have them. So if you'd like to know more, there's a video in the portal, how to use a fire extinguisher. It comes from a local fire department. It's only a few minutes long, but it's a really nice video. It explains not only how to use it, but also when and when not to use it. So well worth a watch if you have time. Severe weather, something also you could encounter. And I think this will vary depending on the geography of your office. So if you're in a flooding area, you prepare for that emergency more than you would something else. So there is some guidance in the EAP, but focus on those emergencies that are, again, more likely to happen given your location. You could encounter a bomb threat. Typically, it might be a phone call. Certainly, you always want to alert 911, but if you do get a call, the idea is to keep the caller on as long as possible. Maybe you'll be able to, the authorities will be able to trace that call, but also you'll record valuable information that will assist in the investigation. Now, here's one that I don't like to talk about, but unfortunately we have to: active shooter. We've seen this in schools. We've seen this in office buildings. So it's worth spending a few moments on it. There are basically three responses. One is to get out of there if you can and call 911, but that's not always possible. So you do want to know where in your building you could hide. Hopefully it has a door that you could also lock or block. And then as a last resort, you're fighting back, you're throwing objects at the perpetrator. But But I think we have to be prepared for such situation. And there's a video in our portal called Active Shooter, What You Can Do. It comes from the Department of Homeland Security. Again, I think this is a good one to watch as a team. Talk about, again, where in your space would be a good place to hide if you couldn't get out. But unfortunately, in this day and age, we do have to be prepared for such an event. Just wrapping up, I think a best practice is to do what's called a tabletop exercise. That's at a staff meeting, discuss an emergency, talk through a scenario, who's doing what, make sure everybody knows their role, make sure everybody knows what equipment is there, make sure everybody understands the notification that would occur in such an event. And after you do such a training or discussion, record it. Use one of our attendance sheets in the portal. So you can document who was there, what you talked about, the date you did it. You'll be glad you did, because it often comes up when you seek a permit. They'll ask for evidence of emergency trainings, and you'll have had it because it'll be part of your normal practice. That's it. There's a lot more detail in the emergency action plan in the portal, but if you have any questions at all, please reach out. We're happy to help. Thank you.